SMArTVIEW is a study that's looking to see whether or not enhanced monitoring of patients after they leave the recovery room after surgery can improve outcomes for these patients.
There are a large number of problems that patients encounter, complications after these surgeries, that lead to a significant proportion of people coming back to hospital. Up to 18% of all patients after major cardiac or vascular surgery can end up back in hospital because of a complication such as irregular heartbeat or developing an infection after surgery. So these problems tend to brew when people are discharged, and we need better ways of knowing about them early and keeping people well. On the ward, they'll begin to work with a tablet, which is an interface we've developed that really helps them think through some recovery issues, for practical tips at home for staying as well as possible.
And then there's also technology patients go home with, which will allow us to monitor them also in the home setting, because typically what will happen is the patients will come back maybe 30 days after surgery and see a surgeon, but some of those patients will end up having complications which will require them then to get admitted to the hospital even before 30 days. What we're trying to explore is, what if we were able to communicate with the patient on a daily basis, take pictures of their wounds, get their daily weights, get some of their vitals on a daily basis? Could we then mitigate those complications in some of those patients, which we believe is likely the case? We think that the way to really improve outcomes in this setting is that we need a better monitoring strategy, and right now we have too big a gap in terms of times we're seeing patients.
This is a system for keeping you connected and having access to the right care at the right time following your surgical procedure. We want to create a pathway where patient and family feel connected to us so that we can help monitor, keep an eye on their status, and also support them every day through that recovery journey at home to keep them as well as possible. So it's bringing the care right into the patient's and family's living room at home while they're recovering.